Adelante, Blanca.
Muchas gracias. Estimada audiencia, es un
Esteemed
gusto estar el día de
audience,
hoy con todos
it's a true
ustedes.
pleasure to be here
Sean
with you today.
bienvenidos y bienvenidas
Welcome,
a
one and
este
all,
webinar que hemos
to
denominado
this webinar that
Mujeres
we
y
have
Tabaco, una
titled
historia
Women
de
and
riesgos
Tobacco,
para la
a
salud
history of
y las
risks
desigualdades sociales.
for health and social
Este webinar
inequalities.
ha sido organizado por
This
la
webinar
Organización Panamericana de la
has been
Salud,
organized by the Pan
el
American Health
INPI,
Organization,
el equipo
the
de
World Health
tabacología
Organization,
de
and
la
the
Universidad Adolfo Ibáñez
Tobacco
y la
Economia
Coalición América
team
Saludable.
from the
Mi nombre es
Adolfo
Blanca Llorente,
Ibáñez University and
directora de
the
investigación de la
Healthy
Fundación
America
ANAS,
Coalition. My name is
y para
Blanca
mí
Llorente.
es
I'm the
un
Director of
placer hoy
Research at the ANAS
cumplir el rol de
Foundation. It's a
moderadora
pleasure
de
for
este
me to
evento.
moderate this event
Y
here
bueno,
today.
antes de iniciar con
Before
el eje temático,
starting,
unas recomendaciones desde el punto de vista logístico.
some housekeeping items.
Estamos todos conectados en esta plataforma de Zoom.
We are all
Esta sesión,
connected
por favor, tengan en
via
cuenta que está
Zoom.
siendo grabada.
Keep
Les
in mind that this
recordamos
session
que
is
contamos con
being
interpretación
recorded. We also
simultánea
have
en
simultaneous
inglés y
interpretation
español.
available
Por
in
favor,
English and
tenga
Spanish.
presente que esa función en la plataforma varía dependiendo de la
So,
aplicación que esté instalada en su dispositivo. Y si por alguna razón tienen
accessing interpretation is
dificultades
going to depend on
para
the type of
activar
device
alguna
that you
nueva
are
traducción,
using
les
right now.
recomendamos actualizar la aplicación para resolver este problema.
And of course, it's helpful
En
always
este
to
webinar,
update your
les recuerdo
application.
también que,
Now, this
como
webinar,
es habitual, las preguntas deberán
as
enviarse
is common,
exclusivamente por la
questions should
caja de
be sent in
preguntas y respuestas
exclusively
Q
through the
y A,
Q&A
disponible en la barra de
chat
menú
box,
de su
which is
plataforma
at
Zoom.
the
Y en caso de
bottom of the
tener
Zoom
comentarios
platform, the menu
generales o inquietudes
bar. And if you
específicas,
have
por
any
favor, déjenoslo
logistical
saber
questions,
por
general
el chat
questions, just let us
disponible en la
know
plataforma.
via chat on
Les
the
invitamos a
platform.
visitar el sitio web
We would invite you
oficial
to visit the
del
official
evento,
web page
que
of the
también estamos
event,
compartiendo
which we are
en el
sharing
chat del evento. Muchas
with you
gracias.
now
Y
in
en
the chat
cuanto
box. Thank you
ya
very much.
estos anuncios de logística, que espero que nos ayuden a tener un
Having
tránsito muy
now given you these
tranquilo y amable de esta sesión,
logistical matters,
ya
I hope
demos
that
paso
paves the way for this
a
to be a
nuestra
pleasant
agenda de
and
webinar,
easy to use webinar. Now
que como
we
pueden verla en la pantalla,
will get started. You can see up
tiene
on the
varios
screen
elementos. Primero vamos a tener
the
unas
agenda.
palabras de apertura. Después
There
una
first are going to
presentación
be some
introductoria que nos
opening
va a
remarks,
poner
an
a enmarcar
introductory
esta discusión
statement
de
that's going
género y
to frame
tabaco
this
en
discussion
la
about
situación
gender
actual de
and
la
tobacco,
epidemia de tabaquismo. Y luego vendremos al
tobacco
plato
use,
fuerte de nuestro webinar de
and
hoy, que es
then
un
the main
conversatorio de
part
aproximadamente unos
of this
40
platform,
minutos,
which is a
para cerrar
40-minute
luego con unas
conversation
presentaciones que nos
among all,
permitirán
with
tener
after which we
unos
will
mensajes de
close
cierre y de
with
reflexión
some closing
de
remarks
esta
and
mañana.
thoughts and reflections
Bien, y
about
ya habiendo
this morning's
aclarado
session.
estos detalles de organización, le quiero dar la bienvenida
Now,
sin
I
más
would
preámbulos
like
a
to
nuestra
welcome,
invitada especial,
without
Rosa
further ado,
Sandoval, que es
our special
asesora
guest, Rosa
regional de
Sandoval,
control de
who is a
tabaco
regional
de
advisor
la
for
Organización
tobacco
Panamericana de la
control for the
Salud,
Pan
quien
American Health
tendrá unas
Organization,
palabras de apertura.
who has a
Rosa,
few
es un
opening
placer estar
remarks for
contigo
us.
el
It's
día
a
de hoy.
pleasure to have you here
Presenta.
with us. Rosa, you have the
Muchísimas
floor.
gracias, querida Blanca.
Thank you very
Realmente
much,
también para
Blanca.
nosotros, como
For us,
Organización
too,
Panamericana de la
as the
Salud,
Pan American Health
empiezo por ahí
Organization,
agradeciéndote a
let me
ti y
start there.
agradeciendo
I'd like to
a todos los
express thanks
coorganizadores y
to
a todos
all of the
aquellos que van a tener
co-organizers
un
and
rol el día
those
de
who
hoy
have
en
a
este
role to
evento, que
play
realmente
today at
lo
this
consideramos
event,
particularmente especial
which
desde la
we
OPS. Y
deem to be
por supuesto a
very
todos los
special,
colegas que
very
nos
worthwhile,
acompañan.
Pajo. And I
Mientras
also greet
Blanca
all of
hablaba,
our
estaba mirando
colleagues.
el chat. Y me parece siempre gratificante ver cuando
Blanca, I was looking
colegas
at
se
the chat. It's
unen
always
y
gratifying
nos
when I
mencionan de dónde
see
vienen.
colleagues
Y apunté con el
connecting
descargo de que es el
and
orden de
see where
preferencia,
they're
apunté
connecting
que
from.
aquí tenemos
I
colegas
took note
desde
here,
Perú,
no
desde
preference in the
México,
order. I see
Cuba, Costa
folks
Rica,
from
Puerto
Peru,
Rico, Colombia,
Mexico, Cuba, Costa
Argentina, así
Rica,
que bueno,
Colombia,
bienvenidos
Argentina,
a todos.
and the list goes on. I welcome you
Realmente, como
all.
decía, para nosotros
Now, as
es
I
muy
was
especial
saying,
este
it
evento y
is
quiero
very special
compartirles
for us to be holding
la
this event, and I would
motivación,
like
¿no?
to
¿Qué
tell you
nos
a little bit
motivó
about
como
what
PS y con nuestros,
motivated
con nuestras
us to
coorganizadoras,
want
¿no? La
to hold
Universidad
this event with our
Adolfo Ibáñez y
co-sponsors,
Teclas a poner en marcha esta hora y media de conversación.
to hold this
Lo primero es que
1 hour and a
el
half
consumo de
long
tabaco continúa siendo
discussion.
una de las
Now,
primeras
tobacco
amenazas
consumption
para la salud
continues to be
pública
one of the
en nuestra
biggest
región, pero nos
risks
motiva
for health in our
principalmente
region,
que
but the
cuando lo
main
analizamos desde una
reason
perspectiva de
we wanted to
género,
hold this is when we
observamos
take a look at it
desafíos
from the
que
gender
realmente
perspective,
no
we
podemos
see
ignorar.
challenges that
Y
cannot be
seguramente nos han
overlooked.
escuchado en anteriores
Now, we've
oportunidades
heard on
hablar sobre la
prior
feminicización
occasions
de la epidemia de tabaquismo en la región.
about
Entonces creo
the
que
uh,
es oportuno,
epidemic of
aunque
tobacco
sea
use in our
repetitivo
region. I
quizás
think it's
para
very
algunos,
timely, even though it might be
mencionar
some
que
repetitive
en
for
nuestra región la
some,
brecha de
to say
consumo de tabaco
that
entre
in
hombres y mujeres es
our
una de las más
region,
pequeñas
the
en el mundo
tobacco use
además,
gap between men and
muchos
women is the
países
largest compared to
las
anywhere
chicas y
else in the world, and
jóvenes, las mujeres
oftentimes
jóvenes
young
consumen más
girls and
tabaco
women
que
are
los
the ones
cincuenta países
who
donde esto está pasando, y en realidad hay muy poca
use tobacco
diferencia
products
en el
more.
consumo de tabaco
We
entre
see
chicos
a
y
difference
chicas.
between
Esto
men and women in
refleja
their
no
tobacco use.
solamente
So
unos cambios en los patrones de consumo
there have been some
de
changes
tabaco
in
y de nicotina
consumption
en esta región, sino
patterns of
también es un
nicotine
reflejo de
and other tobacco
desigualdades
products in our
sociales,
regions. There are
económicas y
also some
culturales
economic,
que
cultural,
enfrentamos las
social,
mujeres en esta región, y
socioeconomic
somos muy
differences that women
afortunados
in
de
our region
tener
face, and we're very
esta amplia
fortunate
gama
to
de
have
experiencia que nos
this
va a acompañar el día de
broad
hoy, que va a abordar esta
array
problemática
of
justamente desde
experience
todos sus
represented here
diferentes
so that we can
ámbitos.
address these issues
Recordar
from
que
different
un año
angles and
más
different
sobre la agenda de
backgrounds.
tabaco
Now,
es
the
justamente esta respuesta global, y que
WHO Framework
especifica que
Convention on
esta
Tobacco
respuesta
Control
global debe
is
incorporar
a global approach,
explícitamente la
and that
perspectiva de
means
género y reconocer los
also that
desafíos
gender
diferenciados que enfrentamos
matters
las
need to be
mujeres
addressed in
y
this
las niñas.
attempt to control
Este
tobacco use,
compromiso, que
focusing
está
on women and girls.
operacionalizado a través del
Now,
paquete
this has
Empower que lanzó la
there's
OMS y
the
que estoy segura que
Power
muchos de ustedes conocen, ha
program. Many
demostrado
of
que es una
you are familiar with
herramienta
it,
eficaz
and
para
that has
reducir el
proven to be an
consumo de
effective
tabaco
tool to
en general
reduce
en la población
tobacco
proteger
use,
a las
generally speaking,
poblaciones más
throughout the
vulnerables y sus
population
efectos
and the
nocivos.
most vulnerable
Acciones como,
of
por
the
ejemplo, proteger
population,
a la población contra
protecting
la exposición al humo de tabaco, ¿no? Es,
the population against
hemos
exposure
conversado mucho
to
con los
tobacco
panelistas que nos
smoke,
acompañan
secondhand
hoy
smoke. We've spoken
sobre
with many of the
cómo
panelists who
esa
are with us here today
dinámica
about how
y las
this
estructuras
dynamic
de
and
poder o de
the
no poder
structures of power of not
en las que
having
vivimos a veces
power
determinan o
that
han
people find themselves
determinado
in
que
are
las
oftentimes
mujeres
that which
estén expuestas al
leads
humo de tabaco y
to
desarrollen
women
enfermedades
being
sin
more
necesariamente
exposed
haber sido
to smoke
consumidoras
and
de
the
estos
attendant
productos, ¿no?
diseases,
Sobre
even
eso
though they
vamos a
themselves
conversar
might
más.
not be
O en
consumers.
particular, por ejemplo, cómo una intervención como la prohibición de la publicidad, promoción y patrocinio es
And also
particularmente efectiva en proteger a las
sponsorship
mujeres del
and
uso de estas estrategias de marketing que usa la industria tabacalera, que están
restrictions on
particularmente
sponsorship can be a
dirigidas
very
hacia
effective way of
nosotras, nuestras
protecting
mujeres, y sobre
women
todo hacia las
and
mujeres
in their
jóvenes.
exposure to
Nosotros
tobacco
como
products. Now,
PS
at
ponemos a
PAHO,
disposición de nuestros Estados miembros
we
y
make
obviamente
available to the
todas
member
las
states and
organizaciones socias con
to
las que
all of the
trabajamos,
partner
las diferentes
organizations with which
herramientas
we
con las que se
work,
cuentan para
diverse
implementar
tools
estas
available to
políticas
us
que nos
to
permitan
roll out these
proteger,
policies
como
that
digo, a las
enable us
poblaciones
to
vulnerables y a la población
protect
vulnerables y a
the
la población en
vulnerable
general.
populations and the
También
population
somos muy
at large.
afortunados de
We are also
trabajar
very
con
fortunate to
organizaciones no
work
gubernamentales
with
como las
non-government
docentes,
organizations
organizaciones de la academia,
from
como
the
nuestros organizadores,
academia
para visibilizar las
to
tácticas de la
shed
industria
light
tabacalera,
on
¿no? Que como
the
dije
tobacco
antes,
industry's practices.
y muchas son estrategias específicamente
These are
dirigidas
specific
hacia las
strategies
mujeres
aimed
y
at
las
women
niñas.
specifically, oftentimes, and at
Este
girls.
webinar lo hemos vislumbrado, lo hemos desarrollado con mucha ilusión, como un
We're
espacio
very
para
excited when we
conversar
developed this webinar
abiertamente
to open up
sobre estos
a venue for
retos,
us to talk
sobre las
about these
estrategias que
challenges
podemos
and these
impulsar
strategies
para
that
enfrentar
we
estos retos
can
de
push
manera
forward to
efectiva,
tackle
pero
in an effective way
también para
tobacco
destacar el
use, and also
liderazgo
to
esencial, el liderazgo
underscore the
crucial
essential
que
leadership, the
han
crucial
tenido muchas
leadership
mujeres de nuestra
that many
región
women in
para
our
llevarnos a
region
donde
have
estamos el
played
día de hoy en contra del
to bring
tabaco,
us to where we are
y además
now.
también con mucha
And
ilusión con las nuevas generaciones que nos llevarán a
very
mejores
excited also to
lugares
see the
en
new
los siguientes
generation
años. Así
that's
que
taking up the
los
mantle
invito
in
a
this
promover
fight.
estos
So I would
espacios
encourage
en sus
you
propias
to promote
instituciones, en sus
these venues and
comunidades,
opportunities in
una
your communities, in
conversación
your
desde las
organizations,
mujeres sobre
to
las
hold a
mujeres.
conversation
Creo que
from
es algo
the standpoint of
que
women
podemos
by
hacer en
women.
cada
This is something I
tema
think
en el que
that we can
trabajemos, en cada
do
ámbito de desarrollo
everywhere we
profesional
work,
y
no matter what
personal y
the
comunitario.
organization or
Y
system where we work is.
en esta línea de identificar
In this
dentro
vein of
del
identifying
liderazgo femenino qué cosas podemos
women
hacer
leaders,
diferentes, aunque no sea,
women
diría, hacer
leadership,
un
what can
pequeño
we
cambio.
do
Y es lo que
differently
usualmente
to
agradecemos
bring about
hacia el final,
change?
cuando terminamos el webinar. Pero yo quería empezar
I would
con
like
el
to start
agradecimiento
by
a
expressing
tres
thanks
personas que han
to
sido
three
cruciales para que
people
estemos
who have
hoy
played a crucial
discutiendo
role,
estos temas, ¿no? En
who
primer
will be
lugar,
talking about this
a
topic
mi
here
colega
today.
Vivian Sandy,
My
que es
colleague,
consultora
Vivian
del
Sandy,
equipo
who
de
is a
control de
consultant
tabaco
from
y
the
que
Tobacco Control
muy de la
Group,
mano con
working
Selma
hand in
Bobby
hand
de
with
la Universidad Adolfo Ibáñez, han
the
sido el
University
corazón, el cerebro
Ibanez,
y las manos de este webinar, con un apoyo muy decidido de Ana
offering
Cristina Mena, también
support
consultora en el equipo
as a
contra el tabaco de la
consultant
OPS.
in the
Así
team
que
against
gracias a ellas
tobacco at
por habernos
PAHO. Thanks
juntados a
to
todos,
them,
y muchas gracias por este espacio para
we've
darles
made
la
this
bienvenida a este
possible. I
webinar
thank you
y
all
que lo
for the
disfrutemos
opportunity
todos.
for us to
Gracias,
be
Blanca.
holding
Te regreso el
this
micrófono.
webinar. I give you back the floor.
Muchísimas gracias, Rosa. Y
Blanca, thank
bueno,
you very
no
much,
quiero
Rosa.
demorar
I don't
la
want to delay
participación
any
de
further.
nuestra apreciada siguiente invitada, que es la doctora Reina Roa.
Dr. Reina
La
Rohr,
doctora
next
Reina,
speaker.
conocida
Dr.
seguramente
Reina,
por la mayoría de los que nos escuchan hoy, es un
I'm
punto
sure
focal
most of the people listening in
problemático para el
are
control de
familiar with her.
tabaco de la
She's a
República de
focal point
Panamá.
of the
Recientemente se desempeñó
CTC
como
from Panama.
presidenta
She is the
de la
current chair
11ª
of
conferencia de las
the 11th
partes del
Conference
Convenio
of
Marco para el Control de
Parties of
Tabaco,
the
en donde, si me
CTC,
permites un
where,
comentario
and if you would allow
personal,
me to make a
Reina,
personal remark,
fue realmente
Reina,
aleccionador ver
it was quite
un ejemplo de liderazgo
enlightening to see
propositivo,
such
constructivo
a
y sabio.
purposeful
Así que aprovecho
example
este
of
espacio para
leadership. And I take this
felicitarte y
venue
agradecerte por
to
esa labor.
thank you for
En
what
ese
you've done
espacio y
there,
en muchos otros y por
here,
muchos
and
años.
this
Es un honor
space,
tenerte hoy
this
con
venue,
nosotros
and
y
in
deseo
so
lo
many
mejor
others
para
where
tu
you have been over the
presentación.
years. I
Gracias.
give you the floor.
Bueno, muchas gracias, Blanca.
Thank you very
En
much,
primer
Blanca.
lugar, agradecer la
I'd
invitación.
like
Me
to
parece
start by
que
expressing
efectivamente
thanks for this
este
invitation.
webinar es
Indeed,
de
I think
suma
that this
importancia.
webinar
En
is
estos
of the
momentos
utmost
se me ha
importance.
pedido que
Currently,
converse sobre
well,
la
I've been
epidemia
asked to
del
talk about
tabaquismo,
the
datos y cifras. En este marco,
epidemic
pues
of tobacco
quisiera
use
comenzar
in numbers,
reflexionando, bueno,
and I
que
would
el
like to start
comportamiento
by
del consumo de tabaco
talking about
es
the behavior
igual
of
o es
tobacco
diferente entre hombres y
use
mujeres.
as it is
Todos
different
sabemos
between
que
men and
las
women. We
estrategias
all know
comerciales de la
that
industria tabacalera
trade
se
or
centran
commercial
en enfocarse
strategies in
en
the
probar su
tobacco
población
industry
objetivo,
seeks
lo que
to
se ha traducido, como bien
focus on certain
mencionabas,
populations,
en el incremento
and
del
this has
uso de
led to
productos
a
tabacos
rise in
en
the use
mujeres
of
y en
tobacco
adolescentes,
products
lo
in
que ha
women and
implicado una
teenagers,
reducción de la
which has
brecha en
led
la
to
prevalencia del
closing the gap
consumo
in the
entre
prevalence
hombres y
of
mujeres,
use between men and
exponiéndonos a las
women,
mujeres a los
exposing
mismos daños
women to the same
sistémicos que
harm
desde hace muchos años ha
that
impactado a la
for
vida de
many
los
years
hombres.
have had an impact
Ciertamente la
on
población
men.
mundial fuma menos, pero
Now,
la epidemia del
women do tend to
tabaco nos
smoke
acompañará por
less,
mucho tiempo.
but this
Según
epidemic
un
is something
informe
we're going
mundial de
to
la OMS,
be
el
dealing with
número de
for many years.
consumidores
Now,
ha
according
disminuido
to
de
uh,
1.380
we've
millones
gone
en
from
2000 a 1.200 millones
1.3
en
billion to 1.2
2024.
billion in
Desde el
2024. The
2010,
number of
la
people
cifra se ha
using
reducido
tobacco.
en
From
120
2010, we've had
millones, lo que
120 million
representa un
person
descenso de
reduction. This is a
27%.
27%
Uno de
reduction.
cada
Now,
cinco
one in
adultos
each
usa
five
productos de tabaco,
adults use
productos que
tobacco products,
provocan cerca de
products
8 millones
that
de muertes
cause
evitables.
11 millions
Para
of
el
deaths,
2022,
11 million
según la
deaths a year.
OMS, 10 países tenían la
10
prevalencia de
countries in
consumo más
22
altas del
had the
mundo.
highest
En
prevalence rates of tobacco
Nauru,
use
con una
throughout the world.
prevalencia de
Nauru, for example, has a prevalence of
49.5%
49.5%
y un
and a
diferencial
difference of
entre hombres y mujeres de
1.6, a differential,
1.6.
a gap of
Birmania, que tenía
1.6%
una
between men
prevalencia de
and women.
69% en hombres, con una
And
diferencia de 50% entre mujeres y hombres, lo que nos
Myanmar, for example,
indica
we saw
que las
a
mujeres tenían
prevalence of
una prevalencia de
69.4% of men compared to
19.2%.
50%
En el caso de
of
Papúa
women,
Nueva
19% a
Guinea,
difference in
la
Papua
prevalencia
New
en hombres
Guinea.
era 2 veces
Papua
mayor en las
New Guinea,
mujeres.
we have a prevalence
En
of women that's
Indonesia, esta
2.2%
diferencia era
or times rather
21.6
greater than
veces
that of women.
mayor.
In Indonesia, there's a
En Kiribati,
uh,
por cada hombre fumador hay una mujer
21
fumadora.
times greater
Timor
use of
Oriental,
tobacco
por
than
cada
women.
6 hombres
Now, in
fumadores hay
Timor-Leste,
una
for each
mujer
6
fumadora, donde el
male
diferencial
smokers, there is a smoking woman,
porcentual es de
and this is a 54%
54.7%. Para el caso
percentile
de las
gap.
Islas
Now, in the case
Salomón,
of the Solomon Islands,
2.8 hombres,
2.8
por cada
men
2.8 hombres que fuman,
smoke,
hay una mujer fumadora.
or for every 2.8
Esta
men,
diferencia es
there
casi
is
nula
one
en
woman
Serbia,
smoking.
donde
Now,
la
this is something
prevalencia
you
del
really see in
consumo de
Serbia, where the
tabaco en
prevalence
hombres
of
se
tobacco
estimó
use
en
in men is
38.8%
estimated at
y en mujeres en
38.8%, and in women
34.6%. En
34.6%.
Jordán, la
In Jordan,
prevalencia en
the
hombres es
prevalence of
cerca de
men is close to
58% y
58%,
en las mujeres alcanzó
compared to
13.4%.
13.4% in
El
women.
10º país en la lista de
The
la
10th
OMS
country
es Bosnia y
on the
Herzegovina,
list is
donde la
Bosnia and
prevalencia en
Herzegovina, where the
hombres
prevalence
supera
among
a la de
men
las mujeres en
surpasses that of
11%.
women by
Pero ahora bien, ¿cuál es el
11%.
panorama
But
para
what is
América
the outlook
Latinoamérica?
for Latin
Sí,
America?
es un poco diferente.
It is a little
Hay
bit different from
14
the rest of the
países
world.
que
There are 14
ostentan mayor
countries
consumo
that
con
have the highest levels of
prevalencia más
tobacco
alta
use.
se
The
sitúa en
highest prevalence,
28.2%,
28.2%,
en
is
Chile
in
con un
Chile,
diferencial de
with a
5%
differential of
entre hombres y
5% between
mujeres.
men and
En
women.
Argentina,
In
el
Argentina,
diferencial
that
por
gap,
sexo
that
alcanza el
differential by
10%,
sex
mientras que en
reaches
Uruguay
10%,
el
whereas in Uruguay,
23% de los hombres
23% of
fuman frente a
men smoke
16%
compared to
de las mujeres.
16% of women.
En estos tres países, el
Now, in these
diferencial
three
de
countries,
prevalencia entre
the
hombres y
prevalence
mujeres
differential between men
oscila
and
entre
women
5 y
varies
10%
between 5 and 10%,
en hombres.
and it's higher among men. In Cuba, the prevalence among men is 2.6 times greater than in women, whereas in Mexico that difference surpasses 3.34 times more than, that is, women more than men. In Brazil, there's a difference between men and women in their tobacco use, similar to that which we see in Uruguay, that's 6.6% differential. Although in Honduras, the prevalence is of 12.2%, which is attributable to men, but the prevalence among women is 1.7%. Furthermore, Guatemala has figures similar to Honduras' figures. In the case of Bolivia, prevalence among men is 20.4%, 5 times greater than the prevalence of women. Paraguay reported a prevalence among women of 3.8%, 4.6 times greater than that of men. In the Dominican Republic, for each 2 men who smoke, there's 1 woman who smokes, whereas in Ecuador, the prevalence of tobacco use among men is 15 percentage points greater than that of women. Of the 14 countries, El Salvador and Colombia are the ones that, well, they have similar levels, prevalence. In El Salvador, 1.9% of women smoke, with a prevalence 8 times lower than that of men. This relationship in Colombia shows that 2.7 times more women or men smoke than women. Now, we can say, comparatively, that the prevalence of women in Latin America are the lowest among those that live in those countries that have the highest prevalence in the world. Now, Panama. In 2019, we see a 8.1 differential of, that is, men have 8.1% to 1.9% of women. There's a maturity epidemic among young people in Latin America, among young men, where the difference of prevalence for tobacco use does not show any statistically significant difference between boys and girls among young people. Now, a similar study, a study conducted by De la Tosa and Otero in Spain shows that young people between 14 and 18 years of age place him. We see between 8 and 10%, there's a higher prevalence among women than men of the same age. The gap and the difference between the gap between non-smokers goes down from 81% to 57%, to the extent that, or as young people age and reaches the same level when young people reach between 17 and 18 years of age. Now, countries such as the US, Canada, Australia, New Zealand, the prevalence of tobacco use among women is much higher than that of men, especially in those women that are close to 40 years of age. Generally speaking, the trend of the epidemic, according to WHO, taking a look at the period between 2000 to 2030, it's indicated that the forecast prevalence is going to be of 18% between now and 2030, with the prevalence between men and women, in which men have a 30.6% prevalence level, 5.7% for women. That's 5.4 times higher prevalence for men compared to women. In the case of the Americas, this same estimate shows that the overall prevalence is 14.2, that is 4% lower than the world level, and that men account for 18.8%, that is 11.8% lower than the prevalence of men worldwide. That said, in women, there's going to be a 9.5% prevalence reached, reflecting a figure that is going to be higher by 3.8% compared to the world. In summary, the prevalence of men is going to be 2 times that of women, owing to the fact that prevalence among women of the Americas will be greater than the world average. Only European women will have a greater prevalence compared to Latin American women. 17.9% is a figure for European women. That is 2 times higher than that which we see in the Americas among women. Now, from the standpoint of the number of tobacco users worldwide in 2030, it's estimated that there will be 1.19 billion users worldwide, of which 121 million are from the region of the Americas, accounting for 10%. Of them, 1.4 billion users will be men, 80 million in the Americas, representing 8%. 193 million women will be using tobacco products, of which 42 million are from the Americas, accounting for 21.8% of smokers worldwide. For each 5.2 men who smoke, there is one woman worldwide, but that relationship changes in the Americas, according to this forecast, to 2030, in which there's going to be one woman smoking for every 2 men. We see a forecast reduction of 18.4%, reaching 29.1%, whereas among women it's going to be 7.8%. This is very important because, as the concept note for this event says, a very important initiative was undertaken to seek to carry out this event. That concept note says that tobacco use continues to be a big challenge for public health in Latin America and the Caribbean, given the differentiated way it affects women. As Rosa said, what we see here is that the tobacco use epidemic in the Americas has become a problem affecting women in large degree. The prevalence of tobacco use among women went from 11% in 2010 to 6.6% in 2024 worldwide. We don't forecast that women will reach the goal that we set for ourselves by 2031. Currently, more than 4 of each of 5 users are men, representing 1 billion men who continue to smoke or use tobacco products, even though the prevalence of among men has dropped from 41% to 32% in 2024. Now, to conclude, we see that there's a trend downward for men, but women are still targeted by industry, which is leading to the rise in the prevalence among women. Despite the progress made worldwide, women face specific challenges and difficulties tied to socioeconomic and political inequalities. To understand all of these different, or rather, for us to craft good policies, we need to understand these different dimensions and aspects of this phenomenon, focusing on gender and equity. Now, among more than 100 million people who use currently electronic cigarettes, we see that there is a distribution being of 86 million among adults, 15 million among children between 13 and 15 years of age. Based on available figures, consumption levels among children is 9 times higher than that of adults of e-cigarettes. And we don't see there's going to be, or there is not much of a difference between men and women in the use of e-cigarettes. I thank you very much for this opportunity to speak, and I hope that I addressed all of the issues I was asked to raise here. Thank you very much, Reina. Thank you very much, as always, for those figures. I think your presentation, that of Reina, as well as the opening remarks made by Rosa, make more than clear that we have to talk about the reality of the epidemic of tobacco use, broken down by gender. It's a pressing issue. It has become very important that we address this. Unlike other gender-related issues in tobacco, what we see is there is a partial advantage in that on this matter, we do have data, we do have figures that show us real tobacco use. And that may only be the tip of the iceberg, of course. We need to generate further data. Decades-long research shows the consequences of tobacco use and how that affects women's health, even when they are not users of tobacco use, of tobacco products. Secondhand scope, we saw this in the case of Japanese women, leading to premature death. I think that we have to keep delving deeper into this, generating sufficient data for us to have a better understanding of this phenomenon broken down by gender. Now, in the region of the Americas, as it was said, this is a topic that we can't put off anymore in our discussion of tobacco use. I think the panel that we have convened here today, with whom we are going to be holding a talk for the next 40 minutes, is just a small sample of women in the region who come from different backgrounds, disciplines, with different perspectives from the standpoint of their relative age and experience. A very interesting mix of viewpoints we've convened here, and they are going to enable us to take a closer look, a deeper look, and to delve deeper into that which has just been presented in the opening remarks and presentation. This is just for starters. Emma Thompson was interviewed recently, someone I really appreciate, an actress, in a role that she was playing. And she said that one of the things that she liked about the role she was playing is that it underscored the importance of women expressing their opinion, that they do not remain silent, and that based on what they say, we act accordingly. I think especially women who have experience working in tobacco, oftentimes we find ourselves immersed in a dynamic of power, as Colombians are wont to say. We should remain silent because we're prettier to the extent we keep our mouths shut. But no, we're not going to keep our mouths shut. We're not going to be silent. We are finding paths forward, means for expressing our viewpoints, our needs, and to respond to these challenges from the standpoint of rights and being more inclusive. I would also like to thank those men in the world of this fight against the tobacco who are themselves people who empower and encourage women, helping to pave the way to assist women as they rise as leaders in this discussion. So I'll be introducing our panelists. We have to identify what the needs are. We have to find these different venues and opportunities for us to empower our voices as women.
We will talk about smoking, how it affects equity, the way in which industry with messages targeted at youth affects the health of the population, especially women and girls, and also the economy. And in a more broader way, human rights. So why should we talk about women and smoking? We need to talk about social justice as well. So we are going to look at the slide so we see our wonderful panelist, Dr. Laura Jambi, who will be talking about smoking and gender. She's a coordinator of the Tobacco Control Program of the Ministry of Health in Uruguay. We also have Constanza Garin. She is an economist, a colleague economist. Welcome, Constanza. She is a researcher in tobacco control from the University Adolfo Ibáñez. We also have Andrea Herrera, who is a lawyer and a young activist. She's our spokesperson for this movement that has been strengthened in the last few years among the youth, tobacco and non-communicable diseases, and also Berenice Serra. She is a technical officer on tobacco control at PAHO WHO. And so this is a wonderful panel. And I've seen the comments of those who are waiting for presentations. Our intention was not to have PowerPoint presentations. We would love to have live conversations, but second best is these virtual conversations. So this is an invitation to a conversation. I'm going to be posing some questions, but I hope that this will be an open conversation. I have my 4 panelists in the camera, so we're going to start. I'm ambitious. We are ambitious. There's lots we want to cover. And what I want to do is hear from you. And I want to start with something that calls my attention from Laura's studies. I was talking at the beginning of how important it is to have data and to recognize needs. But what you found is something that really caught my attention. I would like you to share with us the fact that women don't know enough about the damage caused by smoking. Laura, tell us a little bit more about that. Thank you for your question. My greetings to all of you who are connected. And let me thank the organizers for the invitations to join you with panelists, presenters who are leaders, benchmark of this tobacco control effort. It's a pleasure and an honor. As you said, Blanca, in your question, in Uruguay, a few years ago, we did a research and we noticed that the prevalence of smoking had been falling because of tobacco control policies. But when we looked at men and women, the curve was slower. Men's curve was really abrupt. So we decided to do a simple research to see what they knew about the damage caused by tobacco to health. And we talked with women who were admitted to the women's hospital, 300 users, to see what they knew. And we realized that the damage caused by tobacco, like in cardiovascular diseases and also lung problems, the patients knew about that. But when we talked about the progression of cervical cancer, we know that smoking accelerates the precancerous lesions in the cervix and associations to breast cancer. Also, smoking and health linked to early osteoporosis. So those were damages that were specific to women and less well known. When we asked what they knew about smoking and reproductive health, they knew more about the damage of smoking during pregnancy. But at the time, the prevalence of consumption of tobacco in pregnant women was high. It called our attention how high it was. And then there was another study that we conducted with colleagues from Argentina, a study with intervention, 3,000 women in Montevideo and Buenos Aires, and we found a very high prevalence of smoking in pregnancy. This was 2013, 18%. We thought it's not possible. It was almost the same as the general population. We were talking about pregnant women. This has been falling. In Uruguay, it's 5.2%. Smoking in pregnancy has decreased substantially. But what lay beyond this 18%? In the public sector, vulnerable populations, if we looked at the private sector, the percentage was only 5%. So smoking in women is also affected by the inequality in our society, and that was affecting women's health. Very interesting, Laura. And we hope this will also call the attention of those who are listening to us so that they can go deeper in this very important research. This is something that affects me personally when I think about Colombia, the issue of cancer of the cervical cancer. It's one of those cancers that can be avoided if it's detected in time. There's no knowledge, there are cultural obstacles, institutional barriers, but smoking is an additional barrier, an additional risk, and women are not prepared or informed about it. That is really very sad, and that should be an alert for us to look at these public health issues in a cross-cutting way, because it would empower other efforts given such terrible realities as the death because of cervical cancer. Now, broadening our scope, we're going to invite Constanza to tell us about her research. It's another look, but it's also important and very much linked to what Laura was saying, differential economic impact. We must remember that the roles, cultural roles in Latin America show that certain roles, care, for example, is something that women do. We have several studies that show that it's the majority of carers are women in border areas who are more vulnerable, where income is lower. 80% of carers in chronic diseases are women. This means that there are a series of consequences. And Constanza, as an economist, has been working to give numbers to this and to talk about this reality in Argentina. You're going to talk about your results in Argentina. We would like to hear about the evidence you found on this impact from the economic perspective. Hello, Blanca. Thank you for the presentation and for the question. In studies of tobaccos, a regional hub undertook a study in Argentina showing that diseases associated to smoking generates care, a wave of care in homes, and that's a burden on women's shoulders. And this has two economic consequences. First, it reduces their participation in the labor market because they have to give more time to non-paying care, so their available time to work is reduced, or directly they cannot work, and also limits their capacity to generate income, affecting their economic autonomy and also the total income of the home. If we add to that the fact that this is stronger in lower income women. So smoking not only affects health, but it also makes inequalities deeper, inequalities that women face because of their care duties. Thank you, Constanza. I would add the reality that women face when we are already established in the labor market, and there is an event in our family that requires us to stop working totally or partially to take care of somebody who's facing cancer or rehabilitating from an AVC, care that takes a long time. And so the impact is different between when a man has to stop working temporarily and when a woman has to stop working temporarily. This adds up. a series of layers over layers of differential impacts which are unfavorable. And we add to that what Laura was saying. Women themselves are not sufficiently aware of the way in which smoking is affecting our rights in such a dramatic and deep way and profound way. And we've normalized it, and we've accepted it as a reality that we cannot change. I see in the comments, what can we do? Let's be patient, because I'm going to ask the panelists to think about solutions, not only talk about the concerns, but the actions. Continuing with our conversation, let me invite Andrea so she can tell us about the gaze of activist youth. How do you perceive the impact? Not just effects on populations, but the actors, those who are responsible and should be in the center of what we're talking today, the tobacco industry, their marketing tactics that are aimed at teenagers, women, and men. What can you tell us from your youth movement? How do you see this? Thank you, Blanca. Thank you for the question. Thank you to the organization. It's an honor for me to be in this space with such successful women. Now that COP finished, recognizing women with such important roles, some delegations are made up by men, and I would like to imagine if we had equality in these spaces, or at least more women in these spaces in terms of the decisions arrived at. We all know that in this moment, smoking, as we have seen, the consumers are starting to die. That's why tobacco industry recognizes that it's urgent for them to find new consumers. And the younger they are, the younger they start smoking, the better it is for the tobacco industry. And we have to recognize that this can have larger effects or more negative effects. The brain of teenagers, young people, is growing until they're 20. So if they start smoking when they're young, it will have an impact on learning, memory, etc., because the brain is developing. What is the strategy of the tobacco industry and that we recognize as young people? We recognize them. They work in social networks, targeting girls, teenagers, creating an aspirational identity, seeking reference. And they use influencers and other people that generate norms for the behavior of the younger people with messages such as independence, women's liberations, empowerment, self-sufficiency. They link it to successful, glamorous lives, using linking smoking to fashion, being thin, and modern roles. There is an empowerment of women in several areas, and that's what the industry uses, using this message to empower a woman as socially active if she's smoking. And we've seen it with influencers, with singers. Recently, Dua Lipa is in a tour in Latin America, very successful, but we've seen her smoking. What's the effect of this on young people, young women that use these people as a reference? A few years back, they weren't so close to them. Now, because of social networks, you can use what they do as a reference. It's important also to recognize that another strategy used by the industry is to use flavors on cigarettes, both traditional cigarettes and electronic cigarettes, that make them more agreeable, sweeter, more attractive to women. women. Now that we're talking about the fact that there's no difference in consumption between women and men, there's a national study in Peru about the use of drugs in schools, and the data show that the traditional smoking has been reduced, electronic cigarettes as well, but we see an increase in women smoking, maybe because of the use of flavors, because they are attractive in their design, they're easy to carry. So that shows how the industry has been focusing on girls, teenagers. Electronic devices look like makeup, or they are fashionable. Those are strategies used by the industries to want to reach younger consumers. And then the flavors, as I said, mint, vanilla, red fruits, is associated to women, and this is being used by the industry. And all of this with the perception that the damage is less. That's what the young people think. Young people who are taking care of their skin, of their breath, the additives and the strategies used by the industry to present their products is deceitful. It's deceitful to populations that have less information. Thank you. Thank you, Andrea. Of the many interesting things you've shared with us, there's an important point. We have to be aware of the fact that industry uses the narrative of women's rights. We are saying here that the reality is different. The industry is repeatedly violating our rights, and it's not only facilitates but initiates this violation. And as you said, they do it intentionally, using resources and knowledge, political capital, everything they have to ensure that they can do that and they can profit from it. So we have to recognize that. And something else, which you mentioned at the beginning, our challenge in terms of actions and for the state to guarantee our rights is mediated by institutions that are dominated by patriarchy, by the lack of the visibility of the urgent needs that we have to protect our rights. I saw it in economic commissions that are predominantly men when we have to increase tobacco taxes, and it's very difficult for them to understand this reality when we share them. So now I'd like to talk to Berenice about the tools of the Framework Convention for Tobacco Control to face these challenges. This convention is an international treaty for public health. It's a human rights convention, and you can help us broaden this and remind us, because often we forget how it is that it's with its fundamental tools and it from its core, the convention recognizes, demands, and commits the parties to guarantee women's rights. Berenice, can you help us understand that? Of course. Thank you, Blanca, for the question. The reality is that the strategies of the industry violate the rights of women, girls. Specifically, when we talk about the propaganda, they show smoking as something glamorous, sexy, fashionable. They promote a product that causes damage, and at the same time, they position women as a sexy product that can be sold, not only using old strategies as we saw in the 70s and 80s, women smoking and women that were empowered. Now, modern publicity, modern commercials show women that are happy, that have fun. The novelty is kind of hidden, saying, well, maybe not, but we're trying to normalize the consumption of these new tobacco products. And the convention is very clear in its preamble, connecting it to human rights. The Committee for the Rights of Children and CEDAW and the ECOSOC. This committee, in the 14th comment that talks about the right to health, it's important that marketing, production of tobacco violates the obligations of the rights, and these practices used by the industries are a violation. And when we say about violation of human rights, and not just the right to health, we cannot to say you're violating one right only. You're also violating the right to life, survival, healthy environment, education, freedom of expression, because if we're being bombarded with false and deceitful information saying that this product will liberate us, this means that the right to expression is not being guaranteed. The convention against the Belém Convention has said that health policies have to have a gender perspective, so we have equality and non-discrimination. And CEDAW since 2010 has been saying that everything that has to do with industry practices, the exploration of women, women's emancipation, sexual attraction, slimness, what they do with those practices is violate human rights. The recommendation is to promote laws to forbid this type of publicity, and is in agreement with the Article 3 of the Framework Convention for the Control of Tobacco. What's important here is to understand that the strategies of the tobacco industries not only violate human rights, but they are a form of discrimination. Thank you. Thank you for reminding us about interdependence and the indivisibility of rights. We cannot lose sight of that. And that allows us to talk about the tools of the Framework Convention so that we work in concrete ways. Since we don't have a lot of time, I would like to be talking here for a long time, but I have short questions asking for short answers so that we can very quickly look at actions. I begin with Laura. Tell us from the Uruguayan experience, how have we translated the responsibility of the state? And Uruguay is part of the convention on policies to control tobacco, especially geared to public health and rights in general. Laura. In Uruguay, I'd like to share some of the experience we had as we try to segment the message or focus it towards women's health. Sometimes the campaigns from the Ministry of Health and many organizations that work with the ministry, commissions in the fight against cancer, cardiovascular health, among others, the message was directed to women's health. So the whole campaign was geared, and this with the advice of specialists in communication, it was geared to talking to young women, the girls, the group that we saw in which the reduction had stopped. also the pictograms used for health alerts, they change every so often. So we try to make sure that some of these alerts are directed to women, to have messages that are not just general health talking to everybody. Some of those health pictograms have to be directed to women that buy cigarettes and having more personalized messages. Another experience we had in Uruguay has to do with training of health teams that do perinatal care, standard pregnancy care. The work that is done in health clinics and in offices, that they be trained to advise very systematically pregnant women that still smoked. And part of this effort towards training was very extensive, and we think that may have been a factor in the results we've had among those women. And we also started to listen to women within the framework of a study we did with colleagues from Argentina. One of stopping smoking was the study, and we asked women what their obstacles were. What were their obstacles to stop smoking, and then gear interventions towards those barriers that were given us by the women themselves. Thank you very much. Very important. How to work from diagnostic, translated in the policy tools that are within the convention, the framework convention, and this important element of not only recognizing women as an object of the policy, but as an active subject and inclusion. All of those things are very important, and they make us reflect, and we share that concern. Why is it that we see this reduction in smoking cessation in women slower than men's? And another issue in which I've been working a lot, because it's the most cost effective and is based on the gender gaze. Taxes. We don't think about taxes as something to guarantee rights, but if they're well designed, they are. And tobacco taxes, for sure, are that. Constanza, how is it that dealing with taxes can have a favorable impact on the role that women have in our continent, which is carers, and as well as other dimensions? Constanza. Thank you. Well, the mechanism that has led us to increasing the price of tobacco, we did that in Argentina, the study in Argentina, the fact that it reduces remunerated work in women. First, when the price of cigarettes go up through taxes, the objective is for smokers to pay for the damage they cause when they smoke. This increase leads to a reduction in consumption and a lesser prevalence of diseases related to tobacco. Fewer people diseased in the home, then there's fewer non-remunerated hours that women have, and that means women can be in paid work, can work more, and that means that the income goes up.
Now, another effect that raising taxes can have on women's participation in the market. We could talk about a hypothetical rise of 25% in prices, and in this study, as regards women's participation in the workforce, there would be 43,000 new women on average coming into the workplace under that study, and those women who are already working, who were smokers, almost 1.25 more hours of work per week, and caretakers can have a 12% rise in their monthly income as a result of these tax increases. So thank you very much, and I would love to keep talking to you about this topic, and I would encourage you. We have included in the chat a link that will take you to that paper, that study. And of course, at this university, in the Tabaco Economia site, you can find a host of documents. Now, let's hear about the growing and thriving community of young leaders. Andrea, please tell us, what are you doing? What do you have in the works, working with young people to address the industry? Thank you very much, Blanca. And as I said in my prior intervention, the work that we do with the industry is through social networks, and what they do is to seek out chinks in the regulations, so to speak, to reach young people, which are harder to reach. And so we do have a Latin American network of young people from different parts of the continent that all of us work on healthy environments, and we address this issue by trying to close this gap. There is a communication gap between parents and children sometimes, teenage children, between adults and young people. It's not very common that an adult would come to me and come to a young person and say, the tobacco industry is treating you like a fool, taking you for a fool. But you can give them direct messages that is from young people to other young people. So the tobacco industry, they are the problem, and they're not the ones who are going to come up with the solution. So we base our work on scientific evidence that we work with. These are young professionals that are part of this network, and we put together awareness-raising campaigns, communication campaigns, using a very simple, straightforward language. Less smoke, more data is one of our mottos. We talk about the importance of health taxes, as Constanza mentioned, how those healthy taxes can have an effect on people's daily lives. So this is the realm within which we work. This is a very simple, straightforward, direct way also to unmask the industry and what they're up to. It's about opening our eyes and seeing how the tobacco industry is working, to see it for ourselves, and to ensure young people also see it. And we always see how the industry reinvents itself, renewing itself. It's always one step ahead of our preventive measures, and we, in our work, try to make sure that young people are 2 steps ahead of the industry. We want everyone to understand what the effects of smoking is and what evidence we have. I think it would be very helpful if you could continue sharing those links with us. The Youth Alliance or Partnership, Alianza Juvenil, is another group that also there's the WHO youth group that interact and do what your group is doing. We all have to continue ensuring that these efforts move forward to get the message out, not just the message, but getting the whole of citizenry, citizens, young people, everyone, and also young women, get them all on board, raise awareness to kick them into gear, so to speak. And so this is what we all need to strive for. Thank you very much for sharing your thoughts with us, Andrea. It's just a small sample of all that you do, that you just told us about. Now talk about new actions. What are the best practices and what recommendations of human rights established by at the international level have to do with compliance of the mandates of the FCTC?
Gracias, Blanca.
Thank you, Blanca.
Prácticas se centran en un enfoque, perdón, de no discriminación y protección.
Now, one approach is of non-discrimination and of rights, and to do this, we have to take into account the convention framework, the best practices from the human rights standpoint. So, one of the things that can be done is for each country to strengthen its own legal framework. That is a means of avoiding human rights violations, and a part of this is ratifying. For countries to ratify the FCT if they haven't done so. That's not going to change things overnight. This is a legal tool, the framework, to protect the health of women and children. And this is in line with the 2030 Sustainable Development Agenda that seeks to do away with the poverty of all people, gender equality, empowering women, among other things. So the objective here seeks to strengthen the implementation of the framework agreement. When we speak of the CDAO, what it seeks to do is ensure the implementation of this. It is in line with the framework agreement, seeking to eliminate discrimination through these different awareness-raising campaigns, because we see gender stereotypes being exploited by industry. And to make sure that there be health procedures and protective measures that are sensitive to gender, attentive to women's needs, taking into account psychological, social barriers. Associate tobacco use, for example, with weight control. In this patriarchal society in which we live, this is something that might work. Also, monitoring data. It's very difficult to apply public policies if you don't have sufficient disaggregated data. So you've got gender indicators on the one hand in surveillance, health surveillance programs, data collection about prevalence, about tobacco use, morbidity and mortality. All that data is important because that helps us to fashion targeted policies. And that there be a differentiated analysis, impact studies, assessing policies such as raising taxes. That needs to be viewed from the standpoint of whether such measures actually have a differentiated impact among men and women to also reduce that inequality. Thank you. That's a lot of information. Hopefully later we'll have time to break that down, digest it. So I have an anecdote I would like to share to bring this translate this into concrete terms. So the framework agreement provides us with tools to protect rights from the gender perspective. When I was in 2018, Colombia was starting to implement this at the university, and I was part of that team that was pushing for all of the institutional work that had to be done, the groundwork, to ensure that we could translate this FCTC in compliance with it into something concrete, that at least in the academic community, that it be respected. We had the professors and the administrative staff and everyone reacting, pushing back sometimes, but we were very patient, we were very, we persevered, and we had to have the support from the upper echelon of the administration of the university, and so this policy, this helped to change the policy in Colombia. And I remember that I was in charge of a secretariat secretary. Or a secretary actually came to me and she said that I want to thank you very much for the work that you're doing because I myself was not capable of telling my boss, please don't smoke in the office. So thanks for the work that you did. So that was a wake-up call. We have to remember that this has concrete, real, material effects. That is, upholding people's rights, especially in an environment that is highly where there's a hierarchy. The absence of these tools keeps us from changing the work environment wherever we are and other things that harm us. And so this actually enables us, it empowers us. So I have a question, if you would allow me. I'm asking this of the organizers of this. I can't help myself because I want to certainly hear what you have to say, but who would like to volunteer to answer this question? We understand that tobacco use has a big impact in different environments, significant impact. Do you think enough has been done, or do we still have a lot of work to do? Who would like to answer this question?
Laura, adelante.
Laura.
Bueno, creo que la respuesta es que todavía tenemos un largo camino.
I think that the answer is that we still have a lot of work ahead of us because industry is always coming up with new strategies and tactics, and we have to be creative and to keep up with those innovations on the part of the industry. Now, the narrative that the industry is always trying to establish as far as damage control and the new products they're launching, we have to be alert to this because in the tobacco control community, as a country's party, we have our own bans and prohibitions, and there's a topic that has given rise to controversy, and that is that we cannot have any other outlook or viewpoint different from that which is set forth in the FCTC damage control narrative that the industry is trying to present by offering purportedly safer tobacco products. This is something that also has a differentiated effect on women. And everything that our colleagues here have said regarding flavorings, the use of women influencers pushing the use of vaping. And we have to be very mindful of this, watchful of this.
Pero para no dejarlo, sí, y aparte también nos parece importante como avanzar las políticas de control de tabaco.
I think we have to continue moving forward with tobacco control. So if we look at the Empower package, 24 of the countries party have implemented smoke-free environments. Only 10 countries have fully banned these products in certain environments, so that means there's a gap. This is an opportunity. Only 9 countries have the M among their standards. There is room for progress for us to continue working.
Excelente. Bueno, ya quisiéramos tener un poco más de tiempo, pero espero que esto sea.
We wish we had more time. I hope this is just the start of further conversation. So I thank all the distinguished panelists for the time you have given us over the last 40 minutes now. I would like to move on to a video and a message that's been prepared to us, for us. Beatriz is the director of the Healthy Americas Coalition, the International Network of Women Against Tobacco in Watt. Beatriz Champagne has put this video together for us. Hello, thank you very much for inviting me to take part in this event. The speakers who spoke before me touched on the main matters of gender and tobacco, and over these remaining minutes I would like to stress the topic of collaboration and equity. Tobacco control is an area in which no single organization can work alone. Civil society, organized civil society, is the best tool to push it back against the indifference of the tobacco industry. Collaboration with civil society, academia, government, international organizations, community actors, all working together because we all bring our own capabilities and evidence, and we can coordinate outreach or programs that will have a real impact. Advocacy efforts. Now, when you look at the inequalities from country to country and within countries, means that we do have to work together. We have to work to consolidate and create a regional ecosystem of organizations who are committed to defending public health. Our mission is to protect and strengthen civil society in Latin America and the Caribbean for them to have an influence in decision making in tobacco, alcohol, non-communicable diseases, and some other areas as well. We support the revitalization of INWAT, which is the International Network Women Against Tobacco, which since 1990 has been encouraging and pushing, driving leadership of women, always with the gender approach in public health policy, weaving it in. And the main purpose and objective of INWAT is to raise awareness among the public and decision makers about the negative impact, the deleterious impact that tobacco use has on women, girls, adolescents, and to promote action to have a positive impact by fostering women's leadership in tobacco control.
Women that founded INWAT, like Patricia Lambert, Lorraine Grace in Canada, Margareta Hutman from Sweden, Dr. Dumman, who many of you know, she worked at the WHO for many years, Mayor Aggie from India, Ruth Romer, amongst others, managed to ensure that this framework convention to include the importance of the gender perspective. One of the guiding principles of this framework convention, Article 4.2d, underscores the need to adopt measures that respond to the specific gender risks as they design the tobacco control strategies. This mandate is not a minor one. The preamble of the convention reminds us of CEDAW that forces the member parties to adopt measures to eliminate discrimination against women in health. In other words, the tobacco control cannot be gender neutral. Policies have to recognize that women face differential risks, and the protection of their health is an international commitment that's been assumed. And to incorporate this perspective strengthens the coherence of national regional strategies, ensuring that the right to health is equitably complied with. As we have heard from the excellent panelists, tobacco affects women and girls in a very specific fashion. Larger care burdens as they are exposed to smoke, and marketing strategies that are geared toward young women that reproduce stereotypes and try to expand their market. Women continue to have less representation in spaces where policies for tobacco control are negotiated and designed. These spaces, like INWAT and GLASS, allowed for the exchange and cooperation, ensuring that our voices are heard. That's why I celebrate this meeting by University Adolfo Ibáñez and Panjo to give priority to gender and tobacco in our agendas so that our discussion is updated and we continue giving priority to our needs. When we work together, we manage to broaden our messages, strengthen the defense of policies based on scientific evidence, and to anticipate tactics that seek to weaken regulation. We invite you all to join INWA and to use this space to strengthen our efforts so that we reach gender equality in the control of tobacco. Thank you.
Qué maravilla escuchar esas palabras.
Wonderful to hear those words by Beatriz. It's very important to have an organized civil society under the leadership of women so that we have a concrete, real vehicle to channel all the concerns that we are expressing today. Now, I would like to invite Patricia Sosa, the Director for Latin America of the Caribbean of the Campaign for Tobacco-Free Kids, who will talking about women's leadership as we control tobacco. Patricia, you have the floor. Thank you, Blanca, and thank you for your leadership. You are the perfect person to moderate this discussion. They've asked me to give a brief summary of the history and the important people in the history of control, tobacco control, especially women. It's important for everybody to know them, and to know that they were the ones that were opened the way for our work. I've been working for 30 years in campaign for tobacco-free kids, 15 of which have been dedicated to Latin America in the international department. And I have a long history in this movement, and many of the people I will name that I met. First of all, let me say that my organization, the Campaign for Tobacco-Free Freeze, is under the leadership of a woman, Yolanda Richardson, who is a chairperson and CEO of the organization and the tobacco control program, also under the leadership of a woman, Smita Barua. So I work in a context where women are empowered, and the issue of women is very important. There are many people who were pioneers in tobacco control. I will be mentioning some, and this is personal. I'm sure you have some women that you would like to mention. So I will talk about Dr. Gro Harlem Brundtland. She was the Prime Minister of Norway and between 1998 and 2003, and also General Director of WHO. She's key in our movement because she was the leader and facilitator of the Framework Convention for Tobacco Control, giving us a gender perspective since the beginning of the process, and their vision and her vision led to the negotiations, approval, and ratification of the Framework Convention for Tobacco Control. The other person I want to underscore is Judy Canfield. She worked for my organization, Campaign for Tobacco-Free Kids. She was the vice chairman for international issues, and her role was very important in the negotiation of the treaty. She was one of the founders of the Framework Convention Alliance. Now is the Global Alliance for Tobacco Control. We lost Judy in 2007, but her leadership remains. 3 women in our region who are here because they had a crucial role in the global context. We begin with Doctora Vera Luisa da Costa y Silva. She is an extraordinary person, and when the history of global public health is written, she should have a chapter. She's Brazilian. began working in her country, creating the program of tobacco control in Brazil, with which had great influence in the negotiation of the Framework Convention. She had a crucial role in the negotiations, and in 2016, she was designated the chief of the Secretariat. We could talk about her for an hour because she's extraordinary. And the young people that don't know about her, please seek information about her. She's really extraordinary. Now, I'll be talking about Dr. Adriana Blanca, an important leader. She is the chief of the Secretariat now. And Vera Luisa was the Secretariat's chief. When they choose a new head, they try to bring this head from another region. But instead of choosing a head from another region, they kept the position in Latin America because Adriana was an extraordinary candidate. So that shows the quality of the work undertaken by our leaders. Adriana is Uruguayan, a medical doctor. In Uruguay, she was a leader in the process. She worked at PAJO, also guiding important processes, and she was chosen as head of the Secretariat. And the third person, Reina Roa, we heard her at the beginning of this event, an extraordinary person. She's held important leadership positions, and she was the host of COP10 in Panama, the most extraordinary of COPs. And it was thanks to her vision. And she also chaired the last COP in Geneva, the 11th COP, and her work was extraordinary, as we all know. I am going to be sharing now something that is more personal. There's a lot of leadership. We don't have everybody here, but it shows my own leadership and the benefit of being able to work with them. Dr. Reina Roa, Adriana Branco, Rosa Sandoval, who had a very important role. For many years, Rosa and I worked together. She was an important regional leader and global as well. Beatriz Champagne, when I started in tobacco control in 2009, 2010, she was a regional leader, was a mentor of many of us in tobacco control, and I admire her work, admire her persistence. We see also Dr. Estela Viago. She is a doctor in nursing, an important researcher at a global level. She is leader in the industry documents. She worked in San Francisco, where these documents are deposited, and so she's really truly committed to tobacco control. Monica Andrei, the chairman of Aceite Brazil, and also a regional leader, Miriam Amador, Aya Flavia Sagubich. Also, Vivian is there, Mercedes, Yanela Severini. So we have an intergenerational representation. That's been the culture of our movement. Again, more people who've been key. Paula Jones, an important leader. She was the founder of ACT Brazil. Her role was crucial in the regional and global effort. Dr. Veronica Schosch, the president of the Inter-America Federation of Hearts in Argentina, an important institution in Argentina, training, creating capacity. She's also Marita Pizarro, an important role. I could name them all, and I will be here for an hour. We have here leadership by country. Anquita, an important leader in Colombia, as an economist. Carolina Piñeiro from Repapaz, the team in Costa Rica, Nidia Rieta, Nidia, Gabriela Zamora, Flavia, Alejandra, Karina Larron, all the team from Chile, extraordinary, Mexico as well, civil society, an important role, and we have the Argentinian team as well. And write down your name and write down the names of the people I may have forgotten, but I want to conclude with Belén Ríos. She was an activist, one of the most committed, most brilliant in Argentina and in the region. She's a lawyer and director of the legal area of the Argentine organization, working towards having public policies protecting the health. Berenice is Belén's friend and supported her in her career. I know Berenice liked her a lot. When we talk about eliminating discrimination against women, we should also remember Marita Pizarro. What do we want to talk about Belén since we have the opportunity? And we decided to talk about her important role when a report was submitted about the implementation of the convention in Argentina. She did the arguments. She went to New York to recommend the implementation and ratification of the Framework Convention as an effective solution for the negative impact of tobacco on health, and especially in Argentina. We lost her in 2021. We lost her, but not her legacy.
So thank you very much. Thank you, Patricia. That was no easy task, and you came in under budget, so thank you so much. The women and leaders, women leaders that do all of this work. I'm just thinking about the hundreds of women that work in surveillance, inspection, oversight, women who are teachers who are fighting in Congress, fighting against industry, great journalists who have gotten the message out to the public. There is an untold list of women who played such an important role, working also as mentors. And there's so much to be done. We have to keep waging this battle. We've come to the end of this event, and I would just like to have us reflect on something, share something that made me think about a painting or a Japanese piece of art that has a kanji on it in WHO in the halls. And my daughter said, this represents health, but it's also used to indicate strength and perseverance, persistence. One symbol means all of that really struck me. Health writ large, that is what drives us to translate into something concrete these concepts of social justice, which I think is what brings us all here today. It inspires us and gets us up in the morning every day for us to work for this cause. This is something that we all do together among all of us, and today we just saw a small sample of all the different contributions made by our group of panelists, the leaders who share their experience, these women leaders who are working in all these different institutions, navigating this ship as we move along from the different places where we all work, public policy, outreach, advocacy, to create safer and more healthy environments for all women and girls, adolescents, and for the whole community, so we can live free of the harm caused by tobacco use. So once again, I'm grateful to everyone who took part in this, and enjoy the rest of your day. Thank you.